Hi, this is Dr. Neil Flock from the SOARD Journal, and I am talking today to Dr. Ali Aminian, Director of Bariatric Surgery at the Cleveland Clinic. And he's going to tell us about a study about obesity, COVID, and bariatric surgery. So Dr. Aminian, can you tell us a little about your study? Who were you looking at? Who were you evaluating?
So thanks, Neil, for having this opportunity. So in the past 10 months, we learned that obesity can increase the risk of COVID-19, specifically can increase the risk of hospital admission, risk of being placed in the ICU, and mortality. So we wanted to see if surgical weight loss can decrease that risk. So basically, among near 4,000 patients who tested positive for COVID-19 between March to July at Cleveland Clinic Health System, we identified 33 patients who had history of bariatric surgery, and we carefully matched those 33 patients to 330 patients with obesity to see if history of bariatric surgery could be protective.
And now what did the results show? And I'm going to put up a little slide here. What did these results show?
So we found that in the surgical group, their body mass index decreased significantly by about 12 points. Their diabetes significantly improved, their high blood pressure improved, and we eventually found that the rate of hospital admission in the control group was 42% versus 18% in patients who had bariatric surgery. 13% of the control group required ICU admission, 7% required invasive mechanical ventilation, and unfortunately 2.5% died, but none of these occurred in the surgical group.
Wow, those are amazing results. So what would you recommend now to the general public? 42% of Americans have obesity. What would you recommend to them? Because they don't want to get COVID-19. What do you feel that people should do who have a BMI over 40?
So I can assure people that bariatric surgery in the current practice that we practice in the United States is extremely safe and is very effective. So it can improve high blood pressure, diabetes. It can decrease the risk of cardiovascular disease, kidney problem, fatty liver disease. It can decrease the risk of cancer. And based on this growing evidence, surgery can decrease the severity of COVID-19.
Well, that's wonderful. Thank you so much, Dr. Aminian. And once again, you're the Professor Aminian, the Director of Bariatric Surgery at the Cleveland Clinic in Cleveland. And it's just such an honor speaking to you today. Thank you so much, Dr. Aminian.
Thank you, Neil. Thanks for this opportunity.